also for future conversations. If there's anything you think that we should actually highlight in a future conversation, if you want to be part of a future conversation, please let us know, and we'll be in touch with you. And with this, I hand over back to Vivian, but welcome.
Thank you, Nicolene, for that introduction. And again, a warm welcome to all of you joining us. Well, so let's get into the discussion, and maybe to get us in the mood for the session, we have prepared a warm-up question for you. We want to make it as interactive as possible. And I welcome my colleague, Michael Victor, to come in and explain about the exercise regarding Menti. Michael?
Thanks, Vivian. I hope everyone can hear me, and can everyone see my screen in the Menti?
Yes, we can.
Okay, great. So I hope everyone has used Menti or some of these other polling tools. We'll be using this throughout the the conversation today to help create the conversations and to kind of see where people are after different talks and whatnot. If you don't know how to use Menti, you just easily enough, you could either download it on your phone, go to the Play Store, or go to your the apps within your Apple, or just go to www.menti.com and then just key in this code 761879. And questions will come up. So the first question that we have is, of all the effects the COVID crisis is having on women in agriculture, what are you most concerned about, or which one are you most concerned about? You can put more than one answer, but it'd be good to kind of just start off and see what are you most concerned about in terms of the crisis is having on women in agriculture. So good to kind of take the temperature of the room or people virtually and see what people are thinking. There we go. Growing inequities. Okay, loss of livelihoods, loss of progress on gender equality. Interesting. Are there it'd be good to see if there are any others.
Further instructions on the Menti are in the chat box if you haven't gotten on yet. Yeah.
The labor issues, regression to the old norms, uncertainty of when this nearly comes to an end time needed by, more pressure due to house care, multitasking becomes more of a problem. Lack of access to productive resources aggravated. So again, all these are, very much some of the key issues coming out and some of the key effects the crisis is having on women. I'm sure our speakers will talk to this as well. Loss of assets sold off to cope with the crisis. Okay. It's an interesting set of effects. And again, I hope, I think the speakers will speak to these as well. Vivian, do you want to move it forward? I think that we're just going to do the first question. I think we have three more questions throughout the webinar.
Yes, Michael, thank you for taking us through the Menti. And you're right, we'll go back to the Menti exercise at some point during the discussions. So let's move it forward. And at this point, I'd like to introduce our speakers for the day, those who will help us to perhaps delve into the issues further. some of the issues. You've already highlighted them through this first Menti. So our first speaker for today is Dr. Maureen Miruka, who works for CGIAR USA. She's the Director for Gender, Youth and Livelihoods under the Food and Water Systems Unit. So Dr. Miruka is going to give a 10-minute speech on past and emerging on the ground experiences that are related to women in agriculture and some of the risks arising during the times of crisis. So Dr. Miruka, please go ahead.
Thank you, Vivian. It's an honor to be on the first webinar of this kind, representing CGIAR, which, as you all may know, is a humanitarian and development agency that has been around for about 75 years, and that we have presence in 100 countries. And we do, amongst other programming, food and nutrition security, health, education, livelihoods, and protection. And women's protection, issues around GBV. And so, of course, at a time like this during COVID-19, we are specifically looking at the implications that the spread of COVID-19 might have on women and girls, which is at the center of CGIAR's work. We mainly do programming around women and girls, but I'd like to say that we also engage men and boys in this conversation. So CGIAR has had major humanitarian responses during the 2010 cholera epidemic in Haiti, as well as the Ebola outbreak in West Africa between 2014 and 2016. And this has demonstrated how such crises place a huge burden on women and girls because they're responsible for household level disease prevention, and they're responsible for a lot of, the disease prevention and response efforts at household level make them be at greater risk of infection, and they're subject to emotional, physical, and socioeconomic harm. We are especially concerned that the rising cases of gender-based violence. You've seen in Kenya, there's been lots of reports around, pregnancies for girls, in the thousands. And we are learning these lessons also because COVID-19 is not the first emergency that we've had, nor is it the first one that research and development agencies and humanitarian agencies have been called to respond to. But despite all the responses that have been put out there, there is a marked lack of research on the implications of these emergencies on different groups of different vulnerable groups, especially women and girls. CGIAR actually recently did again an analysis that will be published really soon to show that less than 1% of published research papers on the West Africa Ebola crisis, as well as the Zika outbreak, focus on women or the gender dimensions of this. So we have done such analysis specifically for COVID-19, and these results will be out soon. So when we look at the agriculture sector and the responses that we have had in the past and that we are working on right now, we have three key responses for the food and nutrition security work that we do in the agriculture sector to ensure that we can address the needs of women and girls and also work more towards gender equality in the response. So the first thing that we've done and that I'm going to talk about is to really put gender equality at the center. And how have we done that at CGIAR? Right at the beginning of the pandemic, we conducted a rapid gender analysis based on what we know around social norms, around the data, secondary data that was available. But this has since evolved to collect data. The last I checked, we had data from around 5,000 women to show how the crisis is impacting them. And the latest research that we have from that shows that food, income, and rights are on top there, actually not just for women, but also for men and for boys. It confirmed the worst fears that women's burdens are increasing and they are approaching the end of their safety nets, and that they're not represented in leadership and decision-making. And why is leadership important? I think we've already seen that the countries where they have women leaders have led in the response to the COVID-19 crisis. So in terms of research recommendations, I worked in research previously, would be looking at how we work together with researchers to validate this data and how these findings are taken up, and how we continue to generate more data and evidence that show how such crises impact women and how the responses then are going to be tailored towards that. We are adapting our programs to put gender equality at the center. We have a framework that we call She Feeds the World that looks at all of what I'm going to talk about today. And we are already making adaptations on how to program using digital means and all of that. And donors are beginning to ask, what is the efficiency and the effectiveness of these adaptations that we are giving, since we cannot do field work as we are doing, and how are we reaching women and girls and the most vulnerable? That, for me, I feel is an area, again, that research can address in terms of how these adaptations, because it is clear that COVID-19 is going to be here longer than we imagined. The other thing that we are doing with regards to putting gender equality at the center is to look at how we reduce women's burdens. How do we do extra support for caregiving in the agriculture sector? How do we reduce women's workload and all of that? And we have lots of gender dialogues and other approaches that we have used at CARE before. How are these going to be rolled out in the field? We are making lots of adaptations. Again, it would be very welcome for researchers to provide further insights on that. The second key area that we're looking at is scaling up safety nets in the immediate term and in the longer term. And how are we looking at this based on what we have done before and what we are doing for COVID? Giving unconditional cash transfers. Unconditional means you're giving cash transfers with dignity that people might meet their needs the most. But we know what happens within households. We're using, what are they called, mobile cash transfers. Who owns the cell phone within the household, and what are the decision-making dynamics within the household to enable households benefit from this? We've also seen that safety nets largely focus on carbohydrates or starchy foods. How do we ensure that they are balanced and they meet the various needs of women and girls and other members of within the households? The other thing that I feel personally about, and that we have seen, humanitarian responses rarely focus on inputs such as seeds and animal feeds. And so how can research and development practitioners look at how we provide animal feed as a humanitarian response? What has been the experience before and after? This is an area that we really welcome in CARE, because most of our humanitarian responses mainly focus on seed, but we do need to be looking at the animals. And are they gender responsive? As I said, who owns which assets in the household? What are the decision-making dynamics within the household? The last bit that I'll talk about is that is number 3, is to make sure that we continue to enhance access to productive resources within the households. This includes extension information. We are going to have to change that within households. We finance seeds and inputs, as I said, animal feeds, and also equipment. What are the dynamics? How are women accessing this? We need to consider that even if we are moving to digital ways of doing things on the ground, we have work in Peru that is funded by the PepsiCo Foundation. And we actually found, contrary to what people think, 85% of the participants that we work with, they have phones, and 60% of them have cell phones. And remember that our target group is largely women. So in Africa, there is a bigger digital agenda gap for women. So ensuring that women can access still services through WhatsApp and SMS, other radio materials and all of that. We are also developing our Farmer Field and Business School curriculum into virtual tutorials. And in Uganda, we are already using DVD players for farmers to continue their training and all that. So research at this moment can play a key role in ensuring that these 3 areas continue to learn from the past and pick up from the going forward, and that the work that organizations, development organizations such as CARE are doing, actually go into answering the effectiveness, all of these, and that we continue to reach women and girls, and also build back equal. Thank you so much.
Thank you, Maureen. Thank you for those pointers that you have introduced into the discussion. And at this point, Siam is reminding us that it's International Day of Youth. So happy International Day of Youth to all of you. And even as I come back to what Dr. Maureen has said, she has mentioned that there's need to continue to learn from the past. And that's what CARE is doing. So even to move perhaps the conversation forward, I will maybe want us to delve into the next presentation. But at the same time, encourage you to leave your comments, to leave your questions in the chat box so that we can come back to Maureen with your questions and your comments. So at this point, let me introduce our next speaker. And she is Dr. Sophia Haya. Dr. Sophia Haya works for the CGIAR research program on climate change, agriculture, and food security, where she is the gender and social inclusion leader. Dr. Haya is going to talk about applying lessons from one crisis to another and sort of look at the lessons learned from climate change and how they can be applied into this health crisis that we are in. So welcome, Sophia.
Thank you. Hello, everyone. Good morning or good afternoon. So thank you, Maureen, for your introduction to the topic. I think it's a great way. It's a great introduction and easy for me to build on while trying not to repeat some of the things that you've said. So basically, I think as we can all understand, I think the main message is that COVID-19 is intensifying the impacts of climate change. So women, youth, other groups are already experiencing pressures. They're already experiencing difficulties in dealing with the impacts of climate change. But now we have extra pressures on food systems, livelihoods, as well, of course, as on health. So the main climate trends that are affecting women in the developing world are things like variations in rainfall, variations in weather, which are really notable, I think, everywhere all over the world. We all hear that the weather's unusual this month or this season or this summer. So this involves variations in rainfall, droughts, intensive weather events such as flooding or intense heat. I know in Canada, we've been experiencing much more heat, hot summers lately. So all of these will affect the crop seasons, the growth of crops as well, and consequently food security and dietary diversity for households and women as well as their incomes. So as Maureen has already said, women's workloads are also affected as well as their production and incomes and the quality and diversity of food available to the household. So for example, when floods and droughts limit access to safe water, more time and energy will be spent collecting water for sanitation, food production, and animal care. And as well as already has been said, women do tend to have less access to a lot of information technologies, and in Africa, they do have less access to mobiles. So they will have less access to climate, weather, and agro information that will help them cope with climate impacts. And of course, now less access to health information that will help them cope with the impacts of COVID-19. And so we also see other vulnerabilities that are further exacerbated because of social norms dictating women's behavior, relationships between women and men, and power relations in the household. So in times of food insecurity, women will tend to eat last, often skipping meals. So we have these sets of stresses and vulnerabilities already. And then COVID will add an extra stress of increased health and care requirements for the family. Family members are all at home, so that means increased childcare. Women, as I'm sure all of you are closely aware, have been responsible for homeschooling of their children, in addition to everything else. And lockdowns and restrictions on movement also affect women in that they won't be able to work the fields as easily. If public transportation is deemed unsafe, they may not be able to travel at all. They may not be able to take their products to market, and they will also have to cope with overall lower levels of household income. And we've all heard how one of the results of that can be increases in domestic violence as well. And of course, the entire household is under stress, and that carries an emotional as well as sometimes a physical burden. In relation to agricultural production, we're finding we have a few examples of some of the issues that have come up. And so as household incomes decline, we find that the demand for products that women are producing also fails. So for example, in Uganda, women poultry and dairy producers are having difficulty finding markets for their eggs, birds, and milk as a result of COVID-19. And so women's production as well is going bad. They're not getting the incomes that they expected to for this season. There are also implications for livestock management. 75% of emerging diseases are considered zoonotic and will be exacerbated by changes in the environment. So women globally make up 2/3 of the low-income livestock keepers, so that they're again facing increased stresses. Excuse me, the risk of infection is heightened. They again will not be able to sell will not be able to market the proceeds of their livestock. They'll not be able to sell the eggs or the dairy. There will be increased demand for their time in the household, which will affect their ability to care for their livestock. So there's a need to work with them to decrease their workloads required in this activity, to understand safe and secure processes to keep their animals healthy, but also to build on the knowledge that women livestock keepers have for this. So how can we support women's resilience in this context? We've been looking in CCAF's, the gender group has been looking in 4 main areas on how we can do this. Number one is, how do we support let's support women's collective action. Collective action is a means of building capacity, but also providing support for each other, helping them exercise agency in times of crisis. So in one example in India, self-help groups across 27 states have put together and sewed more than 19 million masks, manufactured protective equipment, have manufactured 100,000 liters of sanitizer, and nearly 50,000 liters of hand washing solution, as well as running community kitchens and providing banking and financial support. A second way is to support women producers. So in Senegal, the government is buying rice and cereals grown by women farmers to distribute them to vulnerable households. Although we know there are barriers to women's and access to mobiles, digital transfers, mobile money, and so forth are hugely beneficial for women in giving them control over their income and also helping them actually save the money that they're earning or generating. And as said earlier, women do need access to better information to help them prepare for and address and cope with disasters, changes in weather and epidemics. We need practices and technologies for agriculture that reduce women's workload, as we've seen in terms of perhaps something like the rice drum seeder, which reduces the amount of labor required and increases the rate of planting. We need to promote decision-making by women at all levels. We've seen that countries led by women during COVID-19 tend to have very high rates of recovery and lower rates of deaths, as well as flatter curves. Earlier studies in regards to climate change have seen that CO2 emissions per capita are lower in nations where women have higher political status. So I think the evidence is really coming clear that women need to be in decision-making at all levels, and this is an area where we need to work in the community as well as at the national and global level. So in addition to what we've already discussed on what needs to be done moving forward, I have a few extra comments to make around gender in agriculture, gender and social inclusion in agriculture. We need a lot more sex disaggregated data on the impacts of COVID-19 on health, employment, livelihoods, and food security. 30 seconds, please. How are women, men? We need to understand how women, men, and youth producers, entrepreneurs, and consumers are affected by changes along the value chains, food value chains, and what are the effects on consumer behavior of these pandemics, given women's role as producers, but also their role in household consumption choices. So is this going to mean a rise in local consumption and supporting local producers and local businesses? We're all talking about green recovery. So I think taking these issues and these questions into account will help us move forward that much faster towards a green economy and a green society. Thank you.
Thank you, Sophia. Indeed, great insights as well on how we can apply lessons from climate change and to this crisis that we're having. So at this point, perhaps it's best to engage with the audience further. And I still want to welcome your questions, your comments. Please leave them in the chat box. We are going to come right back onto them. We want to send you into breakout rooms so that we can sort of delve further into what Sophia and Maureen have raised, because I know from your own organizations you have great case studies, you have great insights that perhaps we can harvest. So I want to welcome Michael once again to give us directions on the breakout rooms so that we go in and cover 2 questions. These 2 questions are going to be in the chat box, but what we basically want to do is we want to harvest what you know in terms of the proven tools, approaches, methods for increasing rural women's resilience in times of crisis. And we also want to know perhaps what do we need to know that we don't know yet. So maybe you could help us get those in the breakout sessions. Michael, are you ready?
Yeah, thanks. Yeah, I mean, I think we're ready to go. We have about 4 people, 3 to 4 people in each of the groups. And we'll give you about 8 to 10 minutes. So we'll put you into the groups right now. Okay, here we go. Oh, คุยมันไม่หิวนะเจ้ากินแล้วคุยบอกแล้วคุยบอกกับชีแล้วคุยไม่กินคุยกินเป็นไปนะ Hi, Elena. I've tried to put you into a group. Eileen. Hi, Michelle, Kim, and Beziat. It looks like you couldn't get into a room, but you guys could talk in this room. We have a couple more people coming in. Okay, hold on a second. Ni kuwa kinga. Kuwa mubo. So for those of you who haven't been able to get into a group, sorry about that. You can also talk here, but we're almost done. It will be about another minute and a half, so please wait. And then the other people will come back. For some reason, I wasn't able to assign you guys to a room. But yeah, we're almost done. It'll be about another minute or so. Okay, just sorry guys who weren't able to make it, just one more minute. And then some people are starting to come back, I see. A few more people left. Okay, I think almost everybody's almost back. Here comes everybody. Marianne and Vivian, are you back?
Yes, we are back, Michael. You can hear us? Can you hear me?
Hi, Angelina. Were you able to, you weren't, so some people, yeah, some groups didn't seem to get through in the end. Sorry about that, Angeline. Are you back now, Vivian?
Yes, I'm back, Michael.
Okay. Should we, do you want to move on to the kind of reflections and the Menti?
Oh, yes, Michael. And nice to see everyone back. Thank you, Michael, for taking us through the breakout rooms. And now what we want to do is to harvest what came out in the breakout rooms. And we're going to do this via another Menti exercise that Michael, you are taking us through, right?
Yeah.
Okay, so do you want to give the instructions for that?
Yeah, I do. I just want to find, let me look for the screen where that is. Oh, here it is. Great. Okay, so I'm just going, we have another Menti. And again, if you, you should be able to see my screen now. And for those who had joined before the first Menti, the code is 761 and 879. And we just kind of want, you know, what you guys discussed. What were some of the key, kind of messages and key things that came out in your discussion? So drawing on what we've learned from the climate crisis, what tools or approaches might help increase rural women's resilience during COVID-19? That's the first question. Again, just put in your comments or thoughts there. So some of the key things that came out in your discussions in the small groups. If you weren't in a group, just put down your own thoughts from here.
Mm-hmm.
I know a couple of people, again, apologies, couldn't get into a group for some reason. So, but you have an opportunity to get your voice heard here in the Menti. So that's good. Just another minute or so. Please put your, you know, kind of some key messages or thoughts that came down so we can look at those. So interesting, a good paper on cholera in Peru about strengthening women's collective action, foresight analysis, approaches that create equal voice in governance and decision making. Decision making seems to be a big one, access to information. Great. Let's get up to 10 at least. And if you, yeah, if anything, just put it on. If you weren't able to join a group, just please put it into the chat or into the Menti, whatever's easiest, we can add it on. Again, foresight analysis, different scenarios for policy intervention in a future situation. Increase access to tech, mainly mobile phones. Okay, great. We'll move on to the next one. And again, hopefully we'll have some discussion around some of these things that do come up. Let's move to the question, what are the most pressing gaps in terms of evidence and approaches when it comes to protecting or increasing rural women's resilience during COVID-19? So what are some gaps in knowledge or evidence that we have, which would be interesting? Please write your answers. Any gaps that we have? Here we go. Okay. Lack of on-the-ground surveys and evidence because of lockdowns. I know some people in ILRI have been actually doing online surveys using through phones, which has helped a lot. So not going out maybe, but going directly to surveys through phones. High quality intersectional gender disaggregated data across all areas. Rural women neighborhoods and livelihood risks. Lack of data on scale and magnitude of GBV. how to deal with the new challenges like gender-based violence. Excellent. So a lot about, gender-based violence here, which again came up as one of the critical issues in the beginning as well. Okay, and you can continue putting these in, but maybe it's good to move on to some of the questions and have some discussion around this, Vivian. So do you guys want to take over?
Yes, Michael, thank you for taking us through that session. And I want to apologize to our participants. We are going a bit overboard. We should be winding up by now, but I'm just asking for an extra 10 minutes to go through the questions. So we had earlier on asked for questions in response to Sophia and Maureen's pitch. So at this point, maybe Marianne, we can go into the questions and get some responses around those.
Yeah, that sounds great. So we got a question from for Maureen in the chat box asking for examples of labor-saving approaches that CARE has tested to ease workloads for women.
Thank you for that question. So some of the things that we do to ease workloads for women is providing or ensuring they have access to energy efficient stoves, solar panels. I've seen in Malawi we have groundnut, processing tools and equipment, maize shellers and all that. But we have to go further, and we do that in just changing the social and gender norms around that, because when you provide these implements, sometimes or a lot of times they get taken over by men. So having the deeper conversations around workload sharing and caregiving, as I said, we have a whole toolbox toolkit that has gender dialogues that get to question these gender dynamics at household level between men and boys, and also and women and girls, and also to normalize this at community level, so that it is the norm that men take on more of the the workloads and caregiving tasks that women have, and I can share those after this meeting for wider sharing.
That would be excellent. Thank you, Maureen. We would love to have that for the wrap up of this. And then just a question for Sophia that came in, asking for what kind of supply chain actions can be undertaken that can help women who do not have direct access to markets.
Sure. Sorry, before I answer the question, if I could just add to the previous question from the CCAF's experience. We have been doing some work on what we've been calling gender responsive CSA technologies and practices. There's an article published in a special issue of Climatic Change earlier this year. The special issue was on gender equality in CSA, and the article is on the experience in South Asia of some climate smart technologies that either have been shown to have benefits for women, labor reducing benefits for women's work, or may potentially have labor reducing benefits for women's agricultural production. And also a search on the CCAF's website can produce some studies as well. So on the value chain, basically the first thing I think that needs to be done in regards to women, but also in regards to youth, is you need these analyses of where are women and youth in these value chains, in the food systems, in the value chains related to food systems. You'll find that they tend to be at the lower levels or not involved at all, as was implied in the question. And what can be done to work with them, support them? Work can be done to help improve the quality and the quantity, or the consistency of the quality of women's production, so that it's desirable for supermarkets or markets or so forth, and is seen as desirable for markets. Help them access the funds and the credit they need to improve or increase their production. Transport to market is really important. Affordable, safe, accessible transport, in varying forms, which women can use easily and can use to transport their goods, is a critical gap in many rural areas that needs to be addressed. and work to connect women with markets, with suppliers, with supermarket chains. For example, how can women contribute to fair trade or organic food systems that are so desirable in the developed world? The other side of looking at this is working with farmers' organizations and ensuring that women are active and benefiting from the work with farmers' organizations, and perhaps even identifying key women's organizations to work with. For example, in South Asia, the Self-Employed Women's Association is one major national, actually regional network of women's collective action that supports women in this way.
Great, thank you. It's good to have some specific examples like that, and that's another case where it would be great to include links to some of those resources in the wrap up of this event.
Sure.
So considering that we are going a bit over time, I wonder if we should go directly to our last little Menti question to wrap up the discussions and see what people are gonna take away from this conversation. So Michael, do you want to switch to the Menti screen once more? It's our question is, based on discussions today, what's one new approach or tool you'd consider using to mitigate the effects that the COVID-19 crisis is having on women in agriculture? And it's the same method. Go to menti.com and enter the code. And then if you have any input, please do put it in there, and then we'll see them on the screen in just a minute. Are you seeing, is everyone seeing Michael Victor's screen? I'm seeing it, but maybe not everyone is seeing it. Okay, if you're not seeing the screen, let's just put it into the chat box here. If you have one takeaway from today, one thing, one insight, or new thing that you're gonna take up and use in your work to mitigate the effects of COVID-19 on women in agriculture, then please feel free to type it just into the chat box. And otherwise, we're gonna be wrapping up the whole event and sharing all the resources that we've talked about online as well. Great, so we're seeing some come in the chat box here, the importance of women's organizations, same as we just had before about women's self-help groups, labor-saving technologies, forecast analysis. Great. Vivian, do you wanna just wrap us up?
Yes, I think we should wrap up, even as our participants continue to send in their key lessons that they've gotten from this session. So at this point, I just want to thank each one of you for an interesting and interactive session. I want to thank the audience for your time and for being very active and resourceful. Thank you for the engagement via the chat box and also on social media. I want to thank our speakers, Dr. Maureen Miruka from CARE USA and Dr. Sophia Haya from the CGIAR Research Program on Climate Change, Agriculture and Food Security. Thank you for sharing with us those case studies that have given us good pointers. And I also want to appreciate the team behind the scenes, Marianne Gadeberg, Kathleen Freeman, Nathan Ronald, and Michael Victor, who have been working behind the scenes to ensure that this session is a success. Thank you also to the director of the platform, Dr. Nicolene Dehan, for launching this conversation. So at this point, I want to say, have a good day, and I hope this session has been truly informative for you and for your organization. Thank you, and bye to you.
Thanks to everybody. Anyone who has any new ideas, any other ideas, please let us know for future conversations. That would be great. And thanks to everyone.